Hi, my name is Yvette and this is my how to draw up insulin video. First, what we're going to do is we're going to gather our supplies. So I have my gloves, my alcohol wipe, my gauze, my alcohol wipes, my syringe, and I have a 29 gauge with a 0.5 gauge needle, 29 gauge needle with a 0.5 and 1 ml, which is 100 units syringe. Okay, got my alcohol prep, my hand sanitizer, and my patient, and my sharps container. So first we're going to do is we're going to go and verify our medication that the doctor has ordered. So the doctor is saying to give 4 units of regular insulin subcutaneously and 8 units of NPH subcutaneously every morning before breakfast to this patient. Okay, I'm going to compare this in my EMR system, and I want to do this to make sure I have the right patient, dose, time, drug, route, and documentation. Okay, so first we're going to do is we're going to come into the room. We're going to provide for privacy. We're going to introduce ourselves to the patient. Hi, my name is Yvette, and I'm going to be your registered nurse today. Can I have you confirm your name and date of birth for me, please? John Smith, May 20th, 1995. Perfect. It looks like the doctor has ordered some insulin for you. Insulin is used for this procedure is going to take about 5 minutes. I'm going to be giving you a small injection. And do you have any questions for me? Okay. Do you have any allergies that I need to be aware of? No? Okay, perfect. It looks like your glucose today is 160, so the doctor has ordered this for you, okay? He's ordering 4 units of regular insulin subcutaneously and 8 units of NPH subcutaneously every morning before breakfast. It looks like you're having breakfast in 30 minutes, so we're going to be giving this to you now. Insulin is used for diabetic management. It helps with your glucose to enter the cells to expend energy. Okay, some side effects that can happen with this is nausea and dizziness. During the injection you could get some tingling and burning, and that's normal. Some adverse side effects that we would want you to let us know right away is if you have hypoglycemia, which means your sugar gets too low, or if you start to get hives. Those reactions are more serious, and we need to be aware of these as soon as possible. Is that okay? So we can proceed? Perfect. So I'm going to perform hand hygiene. I'm actually going to be bringing in a second nurse to verify these orders with me. So first what I'm going to do is I'm going to put hand sanitizer. I'm going to grab my vials and I'm going to warm them up and just move them around in my arms back and forth and warm them up a little bit. Once they're warmed up, I'm going to put these down. I'm going to open my syringe. Oh, no, first, I'm going to open these up and we're going to clean the tops of them. I'm going to clean the tops of them. Oh my goodness. This is not the most... There we go. Okay, so we're going to open up my thing. Again, this is a insulin safety syringe, 29 gauge, and the 0.5, 1 ml, 100 units syringe. Okay, so first we're going to do is we're going to be giving 4 plus 8, so a total of 12 units. First, we're going to start with a regular. No. First, we're going to draw up 8 units for NPH and of air. So, 8. Okay, perfect. And we're gonna put this, I don't know if you can tell, but it's very, very little amount. And we're gonna open this. Oop. Oh, it has a safety thing that I put on my hand. That's not gonna work. All right. Actually, didn't realize there was a safety there. So, okay, so we're gonna again confirm 29 gauge. We're gonna do 8, 6, 7, 8. We're gonna do this right one. Okay. I'll slowly take this off. There we go. All right. And we're gonna put this in the one that's more cloudy, in our NPH. We're gonna pull the air down, but we're not gonna draw anything. Lift, and then now we're gonna get an additional 4. We're gonna drop 4 units of air, and then we're gonna put into our regular vial. Push down, and then we're gonna invert it. We're gonna drop 4. Make sure if there's any bubbles that I fling out the bubbles, and then we're gonna take that out. And then we're gonna not draw anything else, but we're gonna go directly into our NPH bottle, and then do another 8. Very, very little amount. So total of 12 units. We're gonna slowly recap with our single hand. Perfect. We're gonna show that it's 12, or is it 10? It's 12, okay. And that's it, and we're gonna administer to the patient and all that. I have my nurse with me that we were going to verify against the EMR system. Other things she said. We're again gonna check against the EMR system, make sure that it's the right dose. Time, drug, route, documentation is before breakfast at 30 minutes. I feel like I'm forgetting something. And that's it. Once we give this to the patient, we're gonna clean up our supplies. And we're gonna make sure that we get the patient comfortable, get them ready, and let them have their breakfast in 30 minutes and document this procedure. Thank you. I want to take off our gloves. What did I forget?